So let's start with the clavicle. We said we have three major bones, which are the clavicle, the scapula, and the humeral head. So now we are starting with the what? With the clavicle. So what is about the clavicle? Now let's dive in deep in this course. The clavicle have what we call the lateral end and the medial end. The lateral end and the medial end. And this lateral end is called the acromial end, while the medial end is called the sternal end. Now take a look at the medial end. This region is the medial end and this region is the lateral end. So what is the medial end forming? The medial end will come and form sternoclavicular joint. Why? Because it's making a joint, it's articulating at the facet of the manubrium of the clavicle, of the sternum, and of the clavicle. So I mentioned facet. So what is facet? A facet is a region at the end of a bone or a joint that helps to join with another bone. So a facets are always located at the end of a bone. At that edge, at that point, at the end of the bone, we have the facet. And what does it do? It helps in accumulation. Now, this clavicle is convex. When viewed anteriorly, the clavicle is convex at the sternal end and concave at the lateral end. And this clavicle is palpable. So when we say clavicle is palpable, what does that mean? It is visible. It's something you can touch. It's something you can feel. So just touch your clavicle. That region is called the what? The clavicle. So let's start. The only bone connecting the trunk to the upper limb. So the clavicle is the only bone connecting the trunk to the upper limb. Now the skeletal connection. The clavicle provides the sole skeletal link between the trunk and the upper extremity. So the only bone articulation within or between the upper limbs and the sternum or the thorax is the what? The clavicle. And adaptable, it is a unique S-shaped function as an adaptable crane holding the limb away from the thorax while facilitating what? Scapular rotation. It facilitates scapular rotation. Why? Because the lateral end is connected to the what? To the scapula, forming what was called acromioclavicular joint. Clinical application. Palpable from sternum to the acromion. It serves as a crucial living measuring tape for anatomical assessment. It is palpable and it can be measurable, and it is measurable, and it's very, very crucial in living measuring tape for anatomical assessment. We have the clavicle microgeometry and the clinical significance. So in the clavicle, we have the inferior surface and the ligaments anchors. We have the sternal end and force dispersion. We have the acromial end and gliding facets. So let's start discussing them one by one. So at the lateral end, which I said which is more flat, and at the lateral end we have what we call the conoid tubercle and the trapezoid line. The conoid tubercle and the trapezoid line. So what are they doing? The conoid tubercle provide area for attachment of what we call the conoid ligament. So if they ask you which area in the lateral clavicle provide area for attachment of conoid ligaments, is called the word the conoid tubercle. Another question: which area at the lateral end provides area for attachment of the trapezoid ligaments, is called the word the trapezoid line. So host of conoid tubercle and the trapezoid line anchors coracoclavicular ligaments suspending the scapula. So we have what we call the coracoclavicular ligament, and this coracoclavicular ligament is divided into two: the conoid tubercle and the trapezoid tubercle. The conoid ligament and the trapezoid ligament. So the conoid ligament is attached at the conoid tubercle, while the trapezoid ligament is attached at the trapezoid line. Let me recap. The coracoclavicular ligament is divided into two, which is the conoid ligament and the trapezoid ligament. So the conoid ligament attached at the conoid tubercle, while the trapezoid ligaments attach at the trapezoid line. So we have the sternal end and the force dispersion. The sternal end is attached at the manubrum of the sternum to form the sternoclavicular joint and bears a large facet for effective force dispersion. It bears a large facet for articulation and for force dispersion. Bears a large facet for effective force dispersion. Now, we have the acromion end or the gliding facet. So what does it do? Carries a small oval facet for gliding. So at the acromion end, which helps them to form the acromioclavicular joint, have a facet at the edge of the clavicle and at the medial edge of the scapula. So clinical implication is that these microgeometries predict injury patterns and guide surgical fixation strategies. Now let's talk about the scapula.